definitely listening to the station right now. And someone is somewhere having, the time of their lives, enjoying the meat and all. The weather is also, aiding that. I am very, very sure of that. But anyway, welcome to Surviving Sickle Cell, show brought to you by Sickle Cell Foundation Nigeria. It's a collaborative effort with Inspiration FM. My name is Kolade Dominate, and I'm not alone on this show and in the studio. But she's joining me by the phone. I'm talking about the consultant, public health and physician and national director / CEO, Sickle Cell Foundation Nigeria, Dr. Akinsete. Good morning to you.
Good morning to you. Eku Ojo. I think that's what Yorubas greet.
Yes, Yorubas. Yes. We're beautiful people.
And then happy Eid to all our Muslim and brothers and sisters.
Yeah, we greet for every reason. Everything.
I'm telling you, as you're sitting down, Eku
everything. Alright, today on the show we're going to be having a conversation about sickle cell disorder and mental health. It's a lot to talk about, right?
Yes, there is.
And the funny thing is, around 9:30, we had a show, talking about the effects of COVID-19, surviving mechanisms and all the rest of that. And what we basically mentioned or talked about, for the most part of the show was the psychological part of it, the mental health of a lot of, and that's the same thing we're talking about today on the show. So I think it just goes in tandem.
Absolutely.
Pretty amazing stuff. So I think for those people who are just joining us for the first time, who probably don't, have an idea of what the show is all about, I think we should just give them like a little bit of introduction as regarding, sickle cell. Yes. So would you do that, Ma?
You go ahead. So you have it down to a fine art now. I can tell you.
All right. So for those people who are just joining us for the first time, we'd like to talk about sickle cell. That this is not a disease. It's not a disease first. It's not something that people can contract, right? Because I know there are a lot of misconceptions out there where people would say, let me stay away from you so that I don't get it. It's not infectious. All right. It can only happen if you have your parents who are probably are also carriers. Maybe you have someone carries an AS genotype and another person carrying an AS genotype, or another person coming together having SS. That's the only way the person can also have it. And most times we always like to refer to sickle cell survivors as warriors. They're not people who cannot do certain things. And truth be told, as much as we say in this society, we should pay attention to them. Once they do the needful, once they can take care of themselves and do the right things, they would live up to the right expected age that they should live up to. I mean, I've spoken to a lot of them who are in a very ripe age. So it's not the case of these people that will probably pass on at age 19 or age 21 whatever the case is. So all those misconceptions are definitely not true when it comes to sickle cell.
Excellent. Thank you so much, Kolade, for setting the stage for us. So it's a disorder of the blood. It's genetic. It's inherited. It's not infectious. And they can live normal, productive lives as long as they are properly managed. The disorder of the blood. And then let's also remember that it can be prevented, it can be treated, it can be managed, and it can be cured now. So that's it. So let's just set the stage there. But very quickly, because indeed we have a lot to talk about when it comes to discussing the mental health aspect, emotional well-being, social well-being of persons with sickle cell. Everybody, in fact, has aspects of these that we need to, be conversant with. Because what is health anyway? The way the World Health Organization defines health is that it's not only when you are not feeling ill, when you have malaria, no, not only that, or when you have high blood pressure, hypertension, or not. No, that's a state of complete physical, mental, social well-being, and not only the absence of disease or infirmity. That's the way it is captured by the World Health Organization, and that's how what we tell everybody else. So you're a complete human being. A complete human being is body, soul, and spirit. In fact, there's an expanded definition that adds spiritual well-being And I think this is absolutely important in a country like ours, Nigeria, where and most Africans, in fact, are very religious. So spiritual well-being must be part of our definition of health. But at the end of the day, you know, what is it? Mental, emotional, social well-being, they're all, you know, they're linked. They're linked to one another. You probably heard the saying that mind and body work together.
Very true.
There is no doubt about that. If you're physically ill, your mind, mentally, you'll be feeling well either. And vice versa. So mind and body do work together. When people we were just speaking earlier that Yorubas greet for everything.
Yeah.
When ill amongst Yorubas, I'm not Yoruba by birth, but I'm by marriage. Yes, I am. So I've learned the language over the years. They tell you, "Ma faraleo."
Don't leave body.
Don't leave your body on the ground, though. You know, the sharagiri that hold yourself together, and that's speaking to the emotional and mental aspect of your being. That you know, don't just let go. You're physically feeling unwell, but don't let the emotional and mental aspect of yourself, of your being, don't let that aspect go. Hold on to that, and that will bring your physical aspect back. So it's not rocket science. It's not something that's strange to all cultures. Mind and body work together, and that cuts across everybody, every illness, every strata. But particularly, I'll talk about those who have sickle cell because of the kind of condition that they have that's usually fraught with pain. We've talked about this on this program, that the pain is so severe that sometimes the pain is worse than labor pain. Imagine somebody who is in pain all the time. How can that person be emotionally well, mentally well? They are linked. So the emotional and mental well-being are linked to how the person feels, the cognition, even how you perform, you know, in mental exercises, including your schoolwork, if you're a student. How you feel, how you think, how you emote, how you behave, how you express yourself, how you react or respond to situations around you, how you engage in your community. All those are parts of your emotional, mental, and social well-being. And if you are not all of these, you are not a completely well person. And these are very important when we're talking about sickle cell, when they have a lot of pain. I would like to talk about red flags.
Okay, let's talk about it.
Persons with sickle cell may not come and tell you, "Oh, I'm not mentally okay." No, not likely at all. Anybody, as a matter of fact, "Oh, I'm not emotionally feeling fine." Sometimes they talk to their friends or anybody can speak to anybody if you're down, and then the persons around you may observe and say, "What's going on? You're not looking too good. What's happening? What's wrong?" You know, and then they begin to draw out information from you. But there are red flags, and then you can only see these red flags when you have what we call a high index of suspicion.
Okay.
A high index of suspicion. We should do that for everybody around us, whether they have sickle cell or not. But particularly, I would say again, because we're focusing on sickle cell, particularly for persons with sickle cell, high index of suspicion. Keep it at the back of your mind that this person may be dealing with situations or circumstances or issues that they're not coming out with. If you have that high index of suspicion, you will ask questions. You need not be a doctor to ask those questions. And who are those that see these red flags? You'll be family, you'll be friends, you'll be neighbors, if anybody around you, okay? Now, what are these red flags? Change in behavior of any sort. You know how a person normally would behave.
Yes.
Somebody may be normally very tidy, and suddenly you are observing that the person is patty and tidy and not tidy around themselves. That's odd. That's odd. And the reverse is also true. You know, somebody becomes suddenly very obsessive, and normally they're not. Or sometimes they go into themselves, into their shells. They become quiet. That's very common. Somebody becomes very quiet, recluse, you know, isolated. You ask questions. Those are red flags. If somebody begins to talk too much, you know, perhaps they're even trying to cover up something. This is somebody who is not normally verbose or, you know, talkative. Suddenly talks a lot. Red flag.
Okay.
If they isolate themselves, they're locked up in their room. Red flag.
Okay.
When pain crises are there, when the patients are in crisis, look out for their mental, emotional well-being at that point more than any other time.
Okay.
Because these are times when amongst persons with sickle cell, you hear more about suicidal tendencies or suicidal thoughts.
Very true.
Suicidal thoughts. So you have to bring out those questions and those answers from them by asking questions. If their work of school is affected or school work is affected, they may go into themselves and be affected one way or the other. These are red flags. Then they may be sharing stories with you. Oh man, my friend, something happened to my friend, and this is the and they're talking in the third person.
Yes.
Whereas indeed they're referring to themselves.
To themselves.
So that can be a red flag. It may not always be so, but it can be so. When they're talking that thought this happened to a friend of mine. Think that this may be happening to them. When they're going through stresses of life, and anybody who goes through grief or a bereavement, for instance, loss of a job, will go through some form of depression or sadness. And those with sickle cell are not immune to that. We all, have these social problems in life. You're evicted from your accommodation, a divorce, or break up with boyfriends and girlfriends. Teenagers, they go through that. They're red flags. So those are the times you hold them by the hands, and say, look, let's see somebody, let's talk. And then they can become secretive when they're not normally so. Red flag. Many times people are not given to crying, but their eyes kind of turn red. Red from sometimes as simple as welling with tears, or it could also be an instance that they're using some substance.
Okay.
So red eyes is also a red flag. Sleeping all the time, a red flag. And when you're talking with someone and they're averting your eyes, averting your gaze, avoiding your eyes, is a red flag. When they're not eating well and normally they eat red flag. They begin to eat too much, again, in other words, it's unusual behavior, red flag. If they become aggressive when normally they're placid people or become hostile, red flag. So many of these things are there. Just look out for them. That's why I said at the beginning what we call a high index of suspicion. Absolutely necessary. But and I also pointed out that who sees these things in your family, your close friends,
people that are close to you.
Exactly. As I'm speaking with you now, if that's my psychiatrist friend, I love engaging with them because as you're speaking with them, they're already making diagnoses in their mind. Or what am I not hearing, or what am I hearing from Dr. Akinsete, that kind of thing. But you see, that is what we may call high index of suspicion. They always think that way, think out that way. So when family, friends, neighbors, anybody sees these red flags, they must speak with our patients with sickle cell, persons with sickle cell, and encourage them to talk to someone or take them to see their doctor. Remember that part of the care and management of sickle cell generally is that they see their doctor at least 2 times a year.
Very true.
So that gives them the opportunity to even talk about the things. And as they're seeing a doctor or health worker or counselor or nurse, it behoves them to ask this question and read between the lines of what complaints the patient is giving. Okay? Read between the lines. The common one is young men with priapism. We've talked about that here. That's painful erection of the penis, that doesn't go down. Many times when they're talking, particularly to female doctors, they don't say. So, but they will avert your gaze. They will be talking about other complaints, and they will not leave your consulting room for a while. There's more to say, but they're not saying. So you have to ask that question directly. Are you having painful erections? And then a patient with sickle cell who has a painful erection, priapism, will also have psychosocial problems.
Okay.
And those have also to be dealt with. So these are the things that you must bring out. And then doctors will now make that diagnosis. What do they write down that this patient has? The common ones are depression, clinical depression, what we call also anxiety state.
Okay.
And then the third one is drug abuse. Drug abuse, sometimes perhaps we are right, perhaps we're not. I don't think it's adequate. We have adequate empirical evidence, but we believe that we don't have as much drug abuse amongst persons with sickle cell in Nigeria compared with the Western world, where they use a lot of opioids and morphine-type medication. The problem we have here is that many of our patients can get this drug across the counter, which is not true.
It's not right.
It's not right. And they are regulated. Proper pharmacies will ask for prescriptions, but I can tell you I've walked into many pharmacies and asked for particular potent opioid-based
medications, and you've been given.
They can sell to you. So it's not right. And that leads to drug abuse. Drug abuse is a whole world of of social, mental, and emotional unwellness, if you like. Those are the kinds of, and then there are prescription drugs that also are abused by persons with sickle cell. Prescription drugs, some, not necessarily this one, there's also simple ones like ibuprofen.
Okay.
That you can really buy across the counter. But unfortunately, use of ibuprofen for a long time can lead to severe health problems like renal failure. So the patient ends up with dialysis or maybe requiring renal transplant. And that is a simple medication called ibuprofen, but they don't know. But it's overused. And that's because they're in pain. But if your doctor prescribes it and will let you know how often you should use it and for how long you should use it, so that you do not end up with renal failure. But there's a particular drug called pentazocine that many hematologists and pharmacologists, pharmacists have written about in relation to sickle cell.
What's it used for?
For pain.
Okay.
But it's a prescribed medication. Well, they have access. And many also are addicted to pentazocine. And what is addiction anyway? Without that pentazocine or without some morphine type drug, they will not be able to do their normal life, the normal things they do on a daily basis. So it's as if that medication has become part and parcel of their physiology.
Okay.
They cannot function without it, even when they're fine, so they look for it. And there are those, we have a number of patients whom we have referred to who are seeing, and those are the good ones, the ones that are seeing experts, the ones that are seeing clinical psychologists, the ones that are seeing psychiatrists, because they're shooting themselves with injections. It started with seeking freedom from pain, but then they became addicted. And addiction is not the way to go. It's a feeling of unwellness, mental, emotional, and social unwellness. Without them, you cannot function. The drug abuse is big. Depression is big. Anxiety states are also big.
Okay.
So we talk about all these things, but at the end of the day, how do you prevent them? How do you manage them? That's where
the main work is actually.
Exactly. There are problems. We must proffer solutions. But prevention is always cheaper and better than cure. So, it's not a one-man show when you talk about prevention. The patients themselves have a lot of role to play. Family has a lot of role to play. So what I call, there's a macro level of prevention and there's also micro level. And the macro level involves what policies there are for control of sickle cell. So there are policies for control of sickle cell, but do they include mental health components? They have to include mental health components. But who sees to that? So that's where we come in. Many NGOs in the sickle cell space. Okay. If they like, you may say we're activists or activists. Well, at the end of the day, what we're ensuring that the government is really pointing us in the right direction, and that they've included in the policy aspects that take care of the patient as a whole, not only the pain, not only the other physical problems of the patient with sickle cell, not only their hip degeneration, not just the stroke that they get, not just the leg ulcers. Those are physical problems. We are saying that the sickle cell policy must include the mental health component. But again, I've said on this program also that policies are good. They come from in our democratic dispensation. The executive develop policies. But the legislature has its own role. They should come up with laws that will give bite to those policies so that the policies will be implemented. Otherwise, policies just stay there and are not implemented. The way you know that if you run foul of law, there are penalties. Then, indeed, they'll be implemented. So policy, legislation, and another important aspect is health insurance for sickle cell disorder. We're dealing with this right now. Many health HMOs, as they're called, health management organizations, will tell you that sickle cell is not good business.
Very true.
They will not insure.
They will not insure that.
Yes, or give them premiums that are through the roof that they can't pay for. So I said, okay, we're engaging with a few of them to say, okay, these are your CSR, your corporate social responsibility. Take on the number of sickle cell patients so that and their coverage will include things like mental health. Okay? And then I've also emphasized that the business of taking care of business of health generally, but particularly for those of us talking about sickle cell, it goes beyond the health sector. There are other sectors that have bearing on the health sector, including education. Because they're in school, the teachers see them, their peers see them. Okay? So those are who will identify those red flags. And so the education sector must also have components that include care for sickle cell, including sickle cell in the curriculum, including sometimes some school systems have health units. If they have a school nurse should be aware of treating sickle cell patients, and that they do have mental, emotional, and social well-being issues. Youth and sports and welfare, social welfare, all these are sectors that should collaborate with health and not just leave it. These are macro level prevention strategies, and I think that's so important that we cannot overemphasize. Then we'll talk about support systems. Besides the health workers, family, that's the basic. School, workplace, friends, religious groups. Thank goodness for us in Nigeria for our churches and our mosques. We are very particular about religion too. So church and mosque and all these religious groups are big parts of our life. They're part of our social structure and they're our support system. So indeed, we should be part and parcel of them. And anybody who has sickle cell or should have support systems that span across all these groups. Okay. And we encourage them to have hobbies. If you have hobbies, they take your mind away from issues around that will compromise your mental well-being. And imagine not having a job. Means of livelihood is very, very important. So many persons with sickle cell are encouraged to take on means of livelihood of their own. If they can, and we encourage them to support them to have businesses, to take small loans, because they're able to pay themselves. Every so often they have lost their jobs because of their ill health, and that leads them to this sliding down the mental and illness slope. So we don't want them to lose their jobs. So those who can have businesses of their own are encouraged to do so. Okay. We support them to get loans and then have like catering business, barbering salons, hair salons, and all that. Then they're able to pace themselves and they're able to contribute meaningfully to the community. Okay, in the micro level, we're talking about the health worker. Okay. The person who's looking after the patient. And of course the family, the friends and the neighbors, that's micro. It's people around you. So we treat the patient as a whole person, as a whole human being. Physical complaints, the crises, ask questions about the patient's life, about their social life, with a young lady in school, sometimes in university. Ask about their boyfriends, ask about their girlfriends. They may not come out with it. So you read between the lines and bring up issues that may affect their social, mental, and their emotional well-being.
We are totally out of time.
We are already. Okay, early recognition, early diagnosis, prompt referral to psychologists, psychiatrists, and so on. And remember, multidisciplinary approach. Okay, and then don't forget, there are non-pharmacological therapies that prevent persons with sickle cell from becoming addicted. If they're going to music, if they're going to art, sports, hobbies, and all that, take care of a lot of pain, and so they won't go into addiction. Okay, so I think so that gives it again. This program is really to pique our interest. Yes. So many of us can go and ask more questions, read more about it, and remember that the person with sickle cell is a whole person, not just a physical aspect. And then something I must add before I leave there quickly is that family members also have encounter emotional and mental problems and challenges because of burnout. Okay. Take care of the patient with sickle cell, and they live that pain, and so we should not forget that aspect. Okay, we should take care of them as well. All right. Okay. We'll
continue next week.
Maybe we should. And then but if you have questions for us, you can reach us on our email. That's very easy. SickleCellFoundation.com. Our website is www.sicklecellfoundation.com, or you can call us on 081 0000 2001. 081 0000 2001. We're on Facebook, we're on Twitter at Sickle Cell NIG, we're on Instagram at Sickle Cell Foundation NG. That's it. So
right. Thank you very much.
Thank you very much, Kaladi.
Thank you very much.
All right. Inspiration FM, as usual.
All right. No problem, Lagos. That's it for the show. Today's done and dusted.